Hello, my friends. This is Dr. Diana as patient, and I am pretty ill. I think many folks have been wondering where I've been this past year and a half, and most importantly, how I can perhaps help many of you as a result. I have something for you if you can make it to the end of the video. See, this past 18 months has been rough, but helpful in the long run. This is one of the mixed blessings about being a patient. It can give me some answers, especially when I have dramatic, overwhelming symptoms, but I have to live through it first. You would think there'd be an easier way to get answers, wouldn't you? But so it is. So, what happened to me? As many of you know, we've been studying abnormal inflammation in many POTS patients, including but not limited to mast cell activation for years now. If you haven't seen our research, that of genetic disease investigators, please check out some of the results on potscare.com. I think much of it is eye-opening and hinted that for many of us, our abnormal inflammation can indeed include mast cell activation, but it's likely not limited to mast cells. I experienced this personally about 18 months ago. I want to offer something to you all today to help prevent others from going through something similar. You see, 18 months ago, I got a couple of infections that caused hemolysis. This is where your red blood cells basically self-destruct. While in the hospital, I developed a couple of hospital-induced infections, one from an IV that slipped and one from intubation, and then things went south. I had about a dozen blood transfusions. My liver shut down. I was on a ventilator and a feeding tube. Had a couple of large blood clots. It was rough, and I was in the hospital for a couple of weeks. The worst part, however, occurred when I was sent home. You see, my inflammation went nuts. It kept getting worse, and I couldn't stop it. I was engulfed in what felt like fire. I continually flushed with tachycardia, pain, had this indescribable feeling of something like hot acid spreading through my body. I couldn't move my arms at all without horrible pain, and my heart was starting to be affected. I never had 4 normal heartbeats in a row, and I was found to have over 35,000 PVCs, that's like skipped beats, in 24 hours. Now, we talk about how stress can contribute to flushing and other symptoms, right? Well, it got so bad that not only would I flush with a stressful thought, I flushed with any thought, anything. Wondered about the weather, flush. Could I get an ice bag? Flush. It was clear to me that I was sensitive because my inflammation increased so dramatically. The worst part of it, though, was that lying down made it worse. Within about 30 seconds of lying down, I would flush dramatically with sweating and tachycardia, and I ended up sitting in my own sweat-soaked pajamas for days. And even now, it's hard to talk about because I knew then I was likely not to get any help with this. Like many of you, I was on my own in this mess. It's a terrible place for patients to be. It took over a year before I could lie down without horrible flushing, and that was torture, honestly. So that's why many of you didn't hear from me for a while. So what the heck caused this, and how can you avoid this plague? Looking back, we identified the likely culprit. You see, I was given IV vancomycin for 2 weeks to try to fight the infections. Vancomycin is likely one of the worst things you can have if you're prone to abnormal inflammation from histamine-producing cells, mast cells, and other cells. It's considered a last resort medication, and it's known to cause something called red man syndrome. Interestingly, and very telling, is that I only experienced mild highs in the hospital, but things escalated later. You see, I had been triggered, and then I couldn't stop the escalation. So I wonder about you. Has this sort of thing ever happened to you, perhaps on a smaller scale? This is where I'd like to help you. I made a wallet card listing the most likely medications that can cause activation of these cells. On the other side, are recommendations to those who need anesthesia, which can also cause problems. I carry one with me, and my husband has one to use for me if I'm unconscious. I don't think I could handle this happening again. No. I do think that part of controlling our tendency for abnormal inflammation is to avoid setting it off. we look at foods that can ignite these histamine-producing cells, but we can't forget medication. So if you'd like one of these cards, please email us your name and address at mcas@potscare.com, and we'll send you one. We'll do so until we've given out 250 of these cards, okay? I hope it's hugely helpful for you and that you're able to avoid the horrible downfall I had. Meanwhile, my friends, I am delighted to tell you that I'm now working full-time at POTS Care, where I'm contributing everything I know about idiopathic POTS and chronic fatigue. It is amazing what we can overcome when we get to the underlying cause, isn't it? And so, my friends, let's continue to change our worlds, one brain cell at a time, if we have to. Gentle hugs to you.